Hi, and good evening, everyone. Welcome to tonight's Vet Girl Real Life Rounds. We're really excited to have with us again Dr. Susan Little, who will be talking about the management of constipation in cats. And the voice you're hearing right now is mine. My name is Dr. Felicia Long. I'm a member of the Vet Girl team that will be moderating the sessions. So I will be behind the scenes during the webinar, answering any questions that you may have, and also saving some of those questions if time allows, so that we can ask Dr. Little herself. Since all of you guys are Vet Girl Elite members, did want to let you guys know, if you weren't aware, that we did add 3 new tracks to our webinar series. We added a large animal track, a technician track, and a leadership track this year, in addition to all the other CE that we've offered. And our leadership track is qualified for continuing education requirements for the Certified Veterinary Practice Manager program. And most importantly of all, if you are attending this webinar live right now, you have active participation. There is no quiz to receive your half hour of CE credit. The CE certificate will be emailed to you within 2 hours of the conclusion of this webinar. However, if you are watching this video later in our archive, you must complete a short quiz to obtain your CE credits. If you have any questions or did not receive your CE certificate by tomorrow morning, please feel free to email our co-founders, Dr. Garrett Pashtinger at garrett@vetgirlontheRun.com or Dr. Justine Lee at justine@vetgirlontheRun.com. And with that, I'm going to go ahead and I'm going to pass the mic over to Dr. Little. Dr. Little, if you wouldn't mind, give our Vet Girl audience a brief introduction and then take it away.
Okay, thank you very much, Justine, for the introduction, and thanks very much to the Vet Girl team for inviting me back. I love doing these webinars. The real life rounds, though, are a little bit stressful because I have to get everything into like less than 30 minutes, so we're going to have a bit of a quick ride. So I am a feline-only veterinarian, board certified in feline medicine and surgery, and I have 2 feline-only clinics in Ottawa, Ontario. That's Canadian, and I love cats. That's probably all you need to know about me. We really want to talk about constipation tonight, so we're going to talk about diagnosis and management. This is otherwise known as the poop talk, one of my favorite talks that I get to give. So just before I get started, I just want to say thanks to a couple of people. Most of the images that I show are my own patients, but there are a couple of images in this presentation that are from some colleagues. So I just want to give a quick thank you to some colleagues who have helped me out tonight. So what we're going to do in the next 25 minutes or so is go through some key assessments that I think are important for managing constipation in cats and obviously assessing the patient when they come in. We're going to talk about an acute treatment that if you have not yet seen this or not yet tried this, it might change your life. Not that I want to promise big or anything, but it's possible it might change your life. If you already know about this, it'll just be a quick review for you. Hopefully it'll be new for some of you. And then we're going to finish up with what are some effective long-term management strategies for those cats that are chronic constipation cases, the repeat offenders that we all love to see. Okay, so let's get started talking about what are the key assessments. What are the things that we need to pay most attention to when we have a constipated cat coming into our practice? Now, I'm not going to spend a lot of time on diagnosis per se, in that most of us pretty quickly figure out that constipation might be part of the issue, either because of things the owner's telling us, things they've observed, like straining in the litter box, for example, although, of course, biggest rule out there, especially if it's a male cat, is a urinary obstruction. Or we pretty quickly become start thinking about constipation based on physical exam. So diagnostically, it's not a big challenge, but we do need to think about getting a complete picture. So first steps in key assessments, of course, are once we have constipation on our radar as possible for a patient, we need to make sure we don't just stop there and say, okay, I know what's wrong with this patient, he's constipated. We need to make sure we've done a really good assessment, that we still get a complete medical history, we still get a complete dietary history, what medications the patient is on. You'll see in particular why that's important in just a minute. And that we do a thorough physical exam, so we want to make sure that we are complete in what we do. We also want to, especially if it's the first time or it's the first time in a while or if it's an older cat, we want to make sure we get a minimum database on these cats. And you'll see as we go through this talk why I think that's important. Of course, some of the obvious things that we're going to talk about are there contributing diseases? Because constipation is interesting in that very often there are contributing problems that make constipation more the symptom than actually a primary problem. So especially with middle-aged and older cats, it should always be in the back of your mind. Is constipation really a primary problem in this cat? Is there a GI issue or a dietary issue? Or is constipation really just a symptom of something else? So that's always important to distinguish if we can, and that's for having a minimum database. And what that minimum database is will depend a little bit on the age of the cat. So in a younger cat, we might only want to do a chemistry profile and maybe a urinalysis. Not that we think it's a urinary problem, but it can help us assess things like hydration status, for example. In an older cat, you might end up adding in a complete blood count, a thyroid a total T4, for example. You might want to do a more complete investigation. So whatever's kind of appropriate for the age of the cat, for what you're seeing on physical exam, and what else you might already know about that cat. Always include electrolytes. It's important to make sure that we know what the electrolyte status is, especially potassium, because some of these patients become hypokalemia for one reason or another. Okay, so I already touched a little bit on this, and that's contributing factors. So we need to make sure, especially with a new patient or a patient that had been doing well for a while and now is getting into trouble again, that we know what could be contributing to this. So one big class is drugs or supplements or something that the owner is giving to the cat that might have been prescribed or maybe not prescribed, some type of supplement that they've picked up. So there is a long list of drugs that have a potential side effect of constipation. There's a long list in people, and a lot of those same drugs we use in veterinary medicine, and we also know that they contribute to constipation in cats. So the antacids are one big group, so acid blockers or H2 blockers. As it turns out, in recent years, we've learned that there's not a lot of indications anymore for using acid-suppressing drugs in cats, not as much as in dogs or in people. And in particular, we don't use them in chronic kidney disease anymore. So there's been some new guidelines on use of these drugs in canine and feline patients. So we should have very, very few feline patients on antacids anymore, especially chronically. So opioids are the other big class. I think opioids cause constipation in pretty much every species that walks the face of this earth. So it is a well-known complication. I primarily will see it in cats that are on more chronic use of opioids, so the sort of short-term perioperative use that we commonly do with this class of drugs for dentistry, for surgeries, where it's a day or 2 days or only a few days. Usually don't see a lot of problems. It's more when we're using it as part of chronic pain management. So your arthritic cat, for example, some of them may be on and off or on long-term opioids. And then the other big group is the antidepressant group, and it's not so much that we're treating depressed cats, it's more that we're using these as behavior-modifying drugs. So the SSRI drugs like Paxil and Prozac, and then the TCAs like amitriptyline, for example, they all have this side effect. We also want to look for any underlying cause of dehydration. Is there a concurrent disease, which we'll talk about in just a minute? Has this cat gone through a bout of several days of vomiting and diarrhea? Now he's dehydrated, and instead of diarrhea, he's constipated. Or does she have some type of pain, chronic pain, impaired mobility, like the arthritic cat, for example? That means the cat's not moving around a lot, not eating and drinking well, not going to the litter box. And then always think about the environment. So we know that the stress of an environment, a poor environment, conflict with other cats, not enough resources, things like this, certainly can cause physical symptoms in cats. And one of the physical symptoms can be constipation. And that might be because, especially in a multi-cat home, if the cat is feeling stressed, they may do more hiding, they may not be out and about as much, they may be reluctant to go to the litter box, things like that. So we did touch on concurrent diseases, and our middle-aged and older cats. I've just put some of the most common concurrent or contributing diseases on this slide, and they tend to have constipation sometimes as a feature, either because they contribute to dehydration, or some of the drugs we use to treat them contribute to constipation, or in the case of GI disease, there's altered motility, arthritis, for example, that's the pain and the altered mobility, and obesity, there's a big link there with constipation as well. So sometimes the answer is managing the concurrent disease better. Sometimes that's actually what we need to do. Here's a good example. This is a patient that, as you can see, has constipation. This cat has chronic constipation. She also has chronic kidney disease, and in the orange circle there, you can see that she's got quite bad arthritis in her knees, and although her elbows aren't on the radiograph, she also has bad bilateral elbow arthritis. So this is really common for older cats. Chronic kidney disease, arthritis, maybe sometimes even obesity. This cat was also overweight, and constipation. And I would bet you the constipation is not a primary problem in this cat. It's contributed to by all of these other diseases. So again, the key is doing good management of those other diseases, as well as treating the constipation, obviously. Okay, so that's our assessment of these patients. So I wanted to spend a little bit on acute treatment. Once we've made the diagnosis, and we have to go ahead and at least deal with this acute episode before we start thinking about long-term therapy. No matter what treatment we pick, it is not going to work well if you have not assessed and corrected dehydration and corrected hypokalemia if it is present. So it's really important to do those things. You may need to take some time to address those issues first before you go ahead and do whatever treatment you want to do for acute management. Have some patience. If the cat needs time to get rehydrated, let's do that. If the cat needs time to get potassium on board, let's do that. It's usually not like an emergency to treat the constipation per se. So if you need time to correct these things, do it first. I'm also a big believer that many of these cats have nausea, even if they're not vomiting. I mean, I think I would in the position of some of these cats. So treating with meropitant would be common in my practice. I want to give cats the benefit of the doubt. I don't want them to have to prove to me they're nauseous before I go ahead and offer treatment. And some of them, depending on how severely constipated they are or how long they've been constipated, might also be in a fair bit of discomfort, or they may have a contributing disease that's causing pain or discomfort. So again, some of these patients will benefit from pain management, especially if they are possibly dehydrated. We might want to avoid NSAIDs. So this is where our opioid class comes in. And even though we worry about long-term use contributing to constipation, in the acute setting, I'm not very worried about it. So, a day or two of opioids I don't think is going to make a constipation case that much worse. But they may benefit substantially from improving their level of discomfort. So I know all of you went to vet school for only one reason, and that was you wanted to learn how to give enemas to cats. I just know all of you are sitting out there saying, wow, that's just why I went to vet school. So it is a standard treatment, giving the enema, and if you do these, we want to make sure it's warm to body temperature. We don't want to put cold fluids into a body cavity. You can do it with water. You can use saline. You can use lactulose. I don't think there's any evidence that one is any better than the other. Typically, we're going to give 5 to 10 mils per kilo per dose. So I know all of you have been in the position where you've spent a day giving enemas to cats with no joy. Well, part of it may be because you didn't take the time to do that full assessment. Maybe you have a dehydrated patient, so they're not going to respond, or a hypokalemic patient, so they're not going to respond. So that's why it's important to always address those issues first. But we still have some cats that just don't respond well, or they hate it, they're difficult to handle. It just may be physically dangerous or difficult to give these cats an enema. So what is our plan B? Well, our plan B has often been, yet again, a big favorite, I know, amongst most of you, and that's general anesthesia with a manual disimpaction. We're going in and we're getting it out. It does require general anesthesia. It requires a surgical plane of anesthesia, and they definitely require analgesia, because if they were not uncomfortable before this procedure, they will be uncomfortable after this procedure. Now, what I'm going to tell you is in our practice, I don't remember the last time we did manual disimpaction, and I don't remember the last time we did more than one enema. And the reason for that is a better acute treatment option that I'm going to talk to you about now. So again, some of you may be familiar with this, but hopefully some of you aren't. And that acute treatment option is a treatment that uses polyethylene glycol 3350, but it's specifically the type that is a colonoscopy prepped solution. And I want to give a tip of the hat to Dr. Tony Carr, who's a professor, an internal medicine professor here in Canada at the University of Saskatchewan. I heard about this treatment from Tony about 10 years ago at an ACVIM forum meeting. So it's not a new treatment. It's also a common treatment in human medicine, which is, I think, where Tony got the idea. So again, first, let's make sure we correct dehydration if it's present. We correct hypokalemia if it's present. Nothing works well in the face of those issues. I always want to give an antiemetic. I already told you that. I might give analgesia, again, not specifically because of this form of treatment, but again, based on my patient, how long they've been constipated, how severely, what other conditions they have. And again, like all of our treatments, we want to rule out complete GI obstruction. And I don't mean colonic obstruction, I mean upper GI obstruction, and that's pretty uncommon. You know, I don't remember the last time that's happened in a constipated cat. So just to be clear about which polyethylene glycol, because I know some of you are thinking, well, that sounds like Miralax or Restoralax. So there's two kinds. The colonoscopy prep solution is what I'm talking about. So this is polyethylene glycol 3350, but it's combined with this cocktail of electrolytes. And it's that cocktail of electrolytes that gives it that purgative effect. So if you've ever had a colonoscopy yourself, you are very familiar with these solutions. And if you haven't had a colonoscopy, you will be having one in the future. We're all destined to have colonoscopies in our future. So these are best for acute treatment because they have a purgative effect. So anything that you would use in your practice for colonoscopy on canine or feline patients, if you do it, or if there's a referral practice you send your patients to where they do colonoscopy, ask them. They're usually human products. They're inexpensive. You get them from the pharmacy. Two common brand names are Colite or Go Lightly. Go Lightly has to be the winner for like the most absurd name or the most tongue-in-cheek name for a colonoscopy prep solution I've ever seen. So compare that to the ones we use for chronic management, the Miralax, the Restoralax. Those ones have no electrolyte additives because we don't want a purgative effect. We want a gentle laxative effect. Okay, so that's the difference. Now, this stuff tastes horrible. Even people don't like it. So in cats, we deliver it via a nasogastric tube. This slide always reminds me never to take a picture of an orange cat that has an orange nasogastric tube in place. But you'll have to trust me that this kitty has a nasogastric tube in place. The colonoscopy prep solution is mixed up according to directions. We put it into an empty IV bag. We attach an IV line, and there on your left, the picture on your left, you can see the IV line is attached to the end of the nasogastric tube. We set up a pump, and we set the rate at 6 to 10 mils per kilo per hour. So I always start at the low end, and over an hour or two, increase up to 10 mils per kilo per hour. You want to watch for nausea and discomfort and so on. Sometimes people ask me, well, it's easier for me to get something like Miralax or Restoralax. Can't I just dissolve that in water as instructed and use that? Well, no trials have been done on the feline side, but in human medicine, they've tried it for the purgative effect that we want, and it does not work as well as the colonoscopy prep solutions. So I would advise you to do this with the colonoscopy prep solutions. So I don't have overnight care in my practice, so I typically will set a patient up for this in the morning. So maybe if a patient comes in one day with constipation, we'll use that day to get our evaluation done, treat any dehydration, treat hypokalemia, give drugs, and then first thing the next morning, patient comes in and gets set up. So the studies that have been done so far, again, most by Dr. Tony Carr, show that there will be a defecation in a median of 8 hours. So these cats without enemas, you can give one enema to get them started if you want, but you don't have to. So without enemas, without manual disimpaction, they will start defecating in a median of 8 hours. That's usually somewhere between 6 to 14 hours with a median total dose of 80 mils per kilo. But, there's not like a specific dose they get. I've given you the rate of administration, but the cat needs as much as the cat needs, right? So most of these cats are going to defecate in well under 24 hours. And it's a much more humane way. So I know they're not thrilled about having a nasogastric tube in place, but it's a whole lot better than having multiple enemas or having a manual disimpaction done. So here's just what it looks like. Here's another little kitty. It's a guy named Roger. Roger's got his nasogastric tube in place. You can see he looks thrilled about the event. Even though I've told him he's not going to have enemas, he still does not look impressed. So here is Roger's radiograph at the time of diagnosis. Roger is a repeat offender. He's been in many times for enemas. And on this particular occasion, it was not long after I'd learned of this procedure from Dr. Carr. So we went ahead and tried it on him. So there is his pre-treatment radiograph. And here he is 6 hours later. So you can see that the stool is softened considerably. He started to void stool. And what you do as soon as these cats start to void stool, certainly, a significant amount, don't wait for them to empty their colon. Just see that they're started, that they're feeling good, they don't need any other care, and then you're going to go ahead and send them home. Why send them home? Everybody poops better at home. You know that. I bet you a lot out there are thinking, yeah, I believe that. Everybody poops better at home. It's less stressful. You're back in with your own familiar toilet. You're not in some strange toilet somewhere. So kitties feel better at home. They're more relaxed. They're likely to eat again. They're likely to move around. That stimulates GI function, and then we'll usually just give a call the next day and check in and see how everybody's doing. So don't wait for them to empty their colon. Now, I'm going to show you a radiograph. So you might want to sit down. If you're not already sitting down, you might want to sit down for this one. I'm going to show you the most dramatically constipated cat radiograph I've ever seen. This is a case shared with me just recently by a veterinarian who heard this talk at a conference and came up to me and shared this radiograph with me and told me that she treated this cat, whose radiograph I'm going to show you, with this polyethylene glycol treatment approach. Okay, are you ready? Here he is. I can hear your gasps. I can hear your gasps coming in over the interwebs. I hear you doing it. So, yep, that cat survived. That cat responded to treatment with polyethylene glycol. That cat was back home in less than a day. So you can treat some quite severely obstipated cats. Again, the key for any of these treatments, let's correct dehydration if it's present. Let's make sure they're not hypokalemic. Let's give an antiemetic, and let's give some analgesia if you feel that it is relevant to that patient. So yes, we can treat some fairly severely constipated cats with this treatment. Okay, so now we're down to long-term management. We've got our acute patient managed. Some of these patients will never have another bout of obstipation or constipation, right? It may have been something temporary that caused their constipation that has now been corrected, or it's unlikely to happen again. But we certainly have a lot of repeat offenders. So let's talk about what are your effective long-term management options for these chronic cases. And that really falls into 4 categories. And the first one we've already discussed, and that's let's make sure that we know all of the concurrent diseases that that patient has that may be contributing or the cause of the constipation. Maybe we have to step up our management of those other diseases. Maybe we have to do a better job managing arthritis. Remember, most senior cats have arthritis. When a cat that is age 10 or older comes into my practice, I assume it has arthritis until proven otherwise. That's how common it is. So we don't want to miss some of these common diagnoses that may actually be part of the problem and that the cat may need treatment for. So identify and manage concurrent diseases. We're going to talk quickly about managing hydration status because colon's like water, after all. We'll talk about dietary therapy, and then we'll end with a little bit about drugs or prokinetics. So for me, it really goes in that order, right? I'm always going to identify and manage concurrent diseases, work on hydration, change to a diet, and we're going to talk about what possible diets you can use, and then I'll only add in drugs or laxatives if we don't get any joy with those other options. So what about water? Well, wet food contains more water than dry food, so we can go that route. Some cats will drink more water if we change from tap water to a bottled or filtered source. You know, our municipal water sources are treated so the water is safe for us to drink, but sometimes cats detect the smell or the taste, and they might not like it. Making sure there's a lot of water bowls around the house. Many of these cats, especially let's say if we have a chronic kidney disease patient, some of those cats may be better off not just for their constipation, but for their underlying disease to be on sub-Q fluids, for example. And here you see a picture of a kitty with a water fountain. Unfortunately, water fountains do not help cats drink more water, despite what the manufacturers may use in their advertising. There's 3 studies in the literature that have all failed to show increased water consumption from fountains. But hey, they like them. It's environmental enrichment, so why not? Okay, so I really think dietary therapy is going to be our first-line treatment per se. And there's different approaches. So you can do a low residue approach. You can do an increased fiber approach. And then the newest class are the types of diets that modulate the microbiome. So I'm not going to spend a lot of time on the low residue or the increased fiber approaches because they've been around a long time. I'm sure you're familiar with them, and I'm sure you have your favorites. I've just put some examples of particular brands on the slide there. So I really wanted to spend a little bit of time on that last group, the new kid on the block. Those are the diets that modulate the microbiome. And the first one out of the gate is the Hill's Gastrointestinal Biome Digestive and Fiber Care. It comes in dry and canned. It just came on the market earlier this year, at least in Canada it did. And it does contain soluble and insoluble fiber, like our more familiar fiber diets do. We want the benefits. Those give us increased water content in the feces, and they give us increased fecal bulk, and that stimulates motility. But what's different about these diets is they contain specific types of fibers that are called prebiotics. So what's a prebiotic? Well, a prebiotic is a type of fiber typically that you and I or the cat don't digest, but it becomes food for the beneficial microbes that live in the gastrointestinal system. So you can think of a prebiotic as a food for beneficial microbes. Why do we want to feed the beneficial microbes? Because if we get a nice population of the microbes that we know contribute to intestinal health, that promote motility, that are anti-inflammatory, they produce postbiotics. And it's those postbiotics or byproducts of bacterial metabolism that provide these energy sources, antioxidant and anti-inflammatory effects. So I would only go to the laxatives if diet alone wasn't helpful, or whatever dietary approach I was taking. Maybe I was adding fiber to the diet. Then I'd add a laxative. The class we want to use is the hyperosmotic laxative class. It's my favorite anyway, I'll say that. So that could be lactulose, or again, here's our friend polyethylene glycol, but now we want the version that's meant for more gentle daily use, right? Because you don't want a purgative effect every day. So that's where the Miralax or the Restoralax comes in, because it doesn't have that electrolyte cocktail. So it's your gentle daily laxative, well tolerated by cats. And then finally, I would only add in a drug if all else fails. And really the drug that's used pretty much exclusively for this purpose in cats, at least in North America, is cisapride. So cisapride has been used for this purpose for a very long time in cats. Remember, it's metabolized in the liver by that cytochrome P450 enzyme system. So there's a few other drugs that use that same enzyme system, and we don't want to double up on those drugs. They would be drugs like erythromycin, which we don't use a lot in feline medicine, but some of the antifungals, the azoles, like itraconazole, for example, uses that same enzyme system. So you just want to check before you combine. Make sure you don't combine drugs using that same enzyme system. And we'll usually start at twice a day at the low end of the dose, 2.5 milligrams, up to the maximum of 7.5 milligrams 3 times a day. That's kind of where you max out with cisapride, ideally given with food. So there shouldn't be that many patients that you have to go all the way to cisapride. Okay, so there is our little summary. Remember to look for these underlying factors, look for concurrent diseases. That might be the clue to why your patient is having chronic constipation, especially when we're treating these cats. Remember to look for dehydration and treat it, look for hypokalemia and treat it, give them the benefit of the doubt and give them something for nausea. They may also need something for the discomfort. Make sure you keep an eye on that. If you haven't tried the polyethylene glycol colonoscopy prep solution treatment, please give it a try. And remember, we've reviewed some of the dietary therapies. Give this new dietary therapy an approach a try in your practice. And we've also had a quick discussion of the best laxative class and really the only drug that's available for use in this situation. Wow. Okay, I'm a little bit out of breath. There we go. That was a little romp through constipation in cats. So thank you very much. I'm just going to turn things back over to Felicia.
Well, thanks, Dr. Little, for such a great presentation. And that's the first time I've heard of the acute treatment with the PEG solution. So I'm interested to try that next time I have a constipated cat in the hospital. So just for our listeners, for tonight, I just wanted to reiterate that you guys should be receiving your CE certificates within an hour of the conclusion of this webinar. If you don't, please definitely go to our website and you can contact us and we'll make sure that you get credit for this. Also at this time, besides putting in your questions for Dr. Little, I would invite you guys to also type in feedback for Dr. Little, our speaker, and then also about the topic. This helps us to kind of gauge what kind of topics that you guys are interested in and how helpful this is for you guys in clinical practice. So with that, let's get to some of our questions. I know there was a question about, you had mentioned treating discomfort for cats with opioids. Do you find that using buprenorphine in cats is as constipating as morphine, or is there a bit of a difference when you use that?
Boy, that's a good question, and I'm not sure I'm the right person to answer that because we don't use morphine in our practice. There may be a Canada-U.S. difference there. Morphine is quite difficult to get for veterinary use in Canada, so I don't think it's commonly used, and so I don't have really any experience. There may well be differences amongst the opioids. Some may be more constipating than others, but I don't have the experience to tell you if buprenorphine is worse or better than morphine. Again, with short-term use, I don't see a lot of issues, and even with long-term use, not every cat is going to have a problem, a constipation problem with an opioid like buprenorphine.
Okay, great. And then there's a question about, I know you didn't really touch on constipation in young kittens, but sometimes we do see cases with very young kittens with constipation, and they don't seem to respond well to fiber or sub-Q fluids. Do you have any special recommendations for kittens that are less than 8 weeks old that might be having constipation issues?
Yeah, that's a special challenge, and I've certainly seen my share of those, and they definitely don't fall into the group that we've been talking about today. They get constipated for different reasons. It may be a hydration issue. It may be an immaturity issue, so their bowel function, their bowel motility may be affected. It may be a side effect of illness. So it's usually not a primary problem. It usually has to do with their diet or their hydration status, concurrent diseases, their level of maturity, things like that. The good news is I know we all struggle with these guys, but they all almost always outgrow it. So I don't know that I have any amazing treatment. Just again, make sure that they're hydrated. Think about lower residue diets for kittens. I wouldn't go the fiber route in young kittens. I'd always go low residue with kittens, and that doesn't necessarily mean a diet that we would use in an adult. It might be something that we concoct for kittens though that has less fiber in it. And then just patience and that tincture of time. They almost always outgrow it, fortunately.
Sounds great. And I know you mentioned correcting the hypokalemia. Have you ever used oral potassium, and can you overdose a patient with oral potassium like you can with IV potassium?
So we use a ton of oral potassium in our chronic kidney disease patients that become hypokalemic, and I have never overdosed a cat on oral potassium. I imagine anything's possible, but I also think it would take a ton of oral potassium, and my guess is the cat would refuse to take it in, because of taste, because of volume. So I've not heard of a case. I'd never say never, but I really don't think that that's a big issue.
And can you talk about the average cost for using like the PEG 3,350?
Yeah, so I never talk about cost for things because it's like it's not relevant
Variable.
because because we're all from different areas. I mean, I'm even a different country than some of you. It's apples and oranges. What I will tell you is that it shouldn't be a high cost. It's the cost of a nasogastric tube, which, costs very little. It's the cost of placing them. In most cats, we can place them without any sedation. If the cat is not very cooperative, some light sedation will allow you to place it. And then they're just, they're getting a radiograph, they're sitting in the cage. So I can't see that there's a high dollar value to this. So in our hands, it's usually cheaper than multiple enemas, and it's certainly cheaper than general anesthesia and manual disimpaction. So the owner is happier, the cat is way happier, and usually the veterinary team is pretty happy about it too.
Yeah, when you don't have to do a manual deobstipation, it's always a good day. And one final question for you. Do you ever get concerned, because a lot of these older cats that get constipated, I find, are usually the fat, obese cats. Do you find that there's a risk of using lactulose in these cats long-term with being at risk for diabetes?
That's a good question, and I'm glad to say the answer is no. So there's no documented risk from using lactulose. It stays in the intestinal tract. It's not absorbed. So you don't have to worry about risk of diabetes. Or even if you have a diabetic cat, you can go ahead and use lactulose. It's safe and doesn't contribute to the disease. That's a great question.
Okay, sounds great. Well, again, thank you, Dr. Little, for such a great, I know it was a well-packed presentation, and really love the new idea for the acute treatment for constipated kitties. And I want to thank our audience for joining us tonight. Again, I hope everyone has a great night. We really appreciate you guys all attending this evening.
Right. Thanks a lot, everybody.